Hi, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of this useful, you're of course welcome to take it and use it as you see fit. Just please make sure you do so safely. So I wanted to demonstrate the rocking exercise today, which is a really great spinal, particularly spinal flexion exercise. But we often use it to help people learn to use their spine sort of as a unit. There's obviously 24 vertebrae, 7 in the neck, 12 in the thoracic spine, the part that attaches to the ribs, and then 5 in the lower back, in the lumbar spine. And in an ideal scenario, each of those vertebrae will be doing a portion of the load, a portion of the work, facilitating the the movement that the spine has to do, sort of twisting and extending, flexing, and also bearing a portion of the load that the spine has to tolerate when we're walking, jumping, lifting, and so forth. So if the load and movement is sort of equally distributed among those 24 vertebrae, we tend to have a happy, functioning spine. However, when parts of the spine become locked and stop doing their job, that means other parts of the spine tend to have to do more work, and that's when we often run into problems. And this exercise is really good for helping to train the spine to redistribute that load in a more equal way. And it's also really important because it's the next step after sort of pelvic tilting and things like that in the regaining of the flexion pattern of the spine, which is basically being able to bend forward to, do your shoelaces or pick something off the floor, which is often the most compromised pattern with people with back injuries. So for this exercise, the rocking, we start in what's called a stacked position. Stacked means knees under hips, so knees under hips, and wrists under elbows, under shoulders. So sort of like I'm in a kind of tabletop sort of position. It doesn't really matter if the feet, the toes are up like this or like this. I prefer in this position. The way I like to teach this is the first step is all you do is sit your bum back onto your heels. Beautiful. And back, bum to heels, and back. And once we're comfortable doing that, all I say is we're going to add a nod of the head. So as I rock my bum back onto my heels, I just start to almost curl up into a little ball like a hedgehog. The world's biggest, ugliest hedgehog. And then we come back. And as we come back, I just allow the head to come back to a neutral position. I don't sort of extend out like this, just back to a nice neutral position. So it's actually quite a simple movement. I rock back, bum to heels, curl up into a ball by nodding the head, and then come back. Rock back, and come back. A nice, simple exercise. The problem I encounter with this one is that as soon as I put people on all fours, anyone who's ever done a Pilates or a yoga class or something like that starts to make things overly complicated, as those modalities sometimes do, which is fine. So, as soon as I put people on all fours who do yoga, they start doing sort of cat-cow type things. Perfectly fine exercise, but that's not what we're doing here. It's actually quite a simpler exercise than that. So think of it as two things that you're doing simultaneously. Bum back to heels and nod the head. And then just back to neutral. We don't have to overextend. We don't have to do funny things with our hips. This is a surprisingly effective exercise, and the spinal clinic I used to work at would give this to almost every single patient, and I really saw fantastic results from people who would only adhere to this one simple exercise. So really worth doing. So this is a great exercise to learn to use your spine as a sort of cohesive unit, but also it's a really important step in regaining your flexion pattern. That is the rocking exercise. Give it a go.